Stop. Your feet may already be warning you. What if your body has been warning you about diabetes every single day, and you've been missing every signal before any blood test, before any diagnosis? The signs may already be visible right on your feet. I'm Dr. Marcus Dexter, and I've been practicing medicine for over 2 decades. And what I've learned, confirmed in my office week after week, is that your body starts warning you about high blood sugar long before any lab result ever would. The very first place it speaks up? Your feet. Today I'm going to show you 9 signs that are already on millions of feet right now that almost nobody recognizes for what they are. For each one, I'll tell you what most people assume it is, what's actually happening inside your body, and one simple daily habit that can protect you. The American Diabetes Association estimates that 1 in 5 Americans with diabetes don't even know they have it. That's over 8 million people with a silent condition quietly damaging their nerves, their kidneys, their vision, and yes, their feet. A $12 blood test can catch this early, but first, you need to know what to look for. Let's get into it. Before we go through the list, drop a comment right now. Tell me your age and answer this. Have you ever noticed any unusual changes in your feet that you just wrote off as aging? I read every single comment on this channel. Your answers shape what I cover next. 10 seconds. Go. Sign 1, tingling or numbness in the feet. Sign number 1. And almost every patient I've seen has already experienced this and explained it away. Tingling, numbness. That pins and needles feeling in the feet. Doctor, my foot just falls asleep sometimes. I was sitting with my legs crossed. Yes, that happens to everyone occasionally. But when I ask, is this happening regularly without a clear reason? And the answer is yes. We need to talk about what's actually going on. Frequent recurring numbness or tingling in the feet, what doctors call peripheral neuropathy, is one of the earliest signs that blood sugar has been elevated for some time. The excess sugar in your bloodstream begins attacking the outer protective layer of your nerves. Think of your nerves like electrical wires. Every wire has a plastic coating that allows the signal to travel cleanly from your brain to your foot. When blood sugar stays high, it's like an acid slowly eating through that coating. The wire still works for a while, but the signals start getting fuzzy. That fuzziness is the tingling you feel. According to the American Diabetes Association, peripheral neuropathy affects nearly 50% of people with diabetes. It is the single most common complication, and it almost always starts in the feet. Daily habit, a 20 to 30-minute walk every single day. Movement keeps blood flowing to your feet and protects those nerve endings. And start reducing added sugar today, not next month, today. Sign number 2. This one my patients describe as the most distressing because it doesn't hit them during the day. It hits them at night when they're alone and trying to sleep. Feet that feel like they're on fire, especially when lying down, with nothing to distract from it. Many people chalk it up to being on their feet all day, summer heat, or just fatigue. But burning in the soles of the feet at night is a classic early sign of diabetic neuropathy. The nerves in your feet have been damaged by excess sugar, and now they're sending incorrect signals to your brain. Your brain receives a heat message, even though nothing hot is touching your foot. Think of it like a fire alarm with a faulty sensor. The building isn't on fire, but the alarm is going off because the sensor is damaged. Your nervous system is doing the same thing. The burning is coming from inside damaged nerve tissue that is asking for help. Research published in Diabetes Care found that burning foot pain is one of the first reported symptoms in patients later diagnosed with type 2 diabetes, often presenting 1 to 3 years before formal diagnosis. 2 habits here: drink at least 8 glasses of water daily. Proper hydration helps your kidneys flush excess glucose and supports nerve tissue. And add more fiber to every meal. Vegetables, legumes, oats. Fiber slows the absorption of sugar into your bloodstream, which is exactly what those damaged nerves need. Sign number 3. Pay very close attention here, because this is the one that stops being uncomfortable and starts becoming genuinely dangerous. Doctor, I had a little blister from my shoe 3 weeks ago. It still hasn't healed. Most small wounds heal on their own, but not when blood sugar is elevated. When blood sugar is consistently high, the tiny blood vessels in your feet begin to narrow and stiffen. Oxygen, white blood cells, and the nutrients that repair tissue simply cannot reach the wound fast enough. Imagine trying to water a garden with a seriously kinked hose. The water exists, it just can't get where it needs to go. That's exactly what high blood sugar does to circulation in your feet, and an open wound that won't close is an infection waiting to happen. The Centers for Disease Control reports that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in the United States, over 100,000 per year. Almost all of them were preceded by a small wound that was ignored. Tonight, after your shower, sit down and look at both feet carefully. Look between every toe. Look at your heels. If you see any cut, blister, or broken skin, clean it, apply an antiseptic, and cover it. If it hasn't improved in 48 hours, call your doctor. Not next week, 48 hours. Sign number 4 is hiding in plain sight. Most people walk past it every single day. Darkening, deep redness, or even a bluish tint around the ankles and lower legs. I think it's just sun damage. I've always had darker skin on my ankles. That may be true, but there is a specific pattern of discoloration I look for when assessing blood sugar risk. When circulation is compromised by high blood sugar, the lower legs and feet don't receive enough fresh, oxygenated blood. The skin changes color as a result, a distress signal you can see with your own eyes, if you know what you're looking for. In some patients, the skin also becomes thinner and more fragile in those areas, a sign the tissue isn't being properly nourished. Think of your blood as a delivery truck carrying oxygen and nutrients. Your feet are at the end of the longest delivery route in your body. When the roads narrow from blood vessel damage, the deliveries stop arriving on time. The skin, starved of fresh oxygen, changes color. A study in the Journal of the American Academy of Dermatology found that these skin changes are detectable on average 18 months before a formal diabetes diagnosis. Daily habit: 5 minutes of ankle circles, toe raises, and calf stretches every morning. Even that small amount of movement gets blood flowing to your feet. If you're finding this useful, hit the like button right now and subscribe if you haven't already. I post new health content for seniors every single week, and your support is what makes this possible. Now, let's keep going. Sign 5, 755 to 910. Sign 5, severe persistent heel cracking. Sign number 5 surprises patients the most because it looks completely harmless. Most people have had it for years. Doctor, my heels crack every winter. It's just dry skin. Yes, that's extremely common. But when your heels are cracking badly in the middle of summer, or no moisturizer seems to help no matter how much you use, that is a completely different story. Diabetes affects the autonomic nerves, the ones that control automatic functions you never think about. One of those functions is regulating moisture and sweat in the skin. When these nerves are damaged, the sweat glands in your feet stop working properly. Your feet lose their natural moisture from the inside out. No amount of lotion fixes the root cause. Think of your skin like a wall that needs to stay sealed. When those autonomic nerves are damaged, the mortar between the bricks starts crumbling. And those cracks are not just cosmetic. They are open doors for bacteria and infection. The American Podiatric Medical Association identifies chronic, hard-to-treat heel cracking as a significant indicator of autonomic neuropathy in seniors, directly linked to long-term elevated blood sugar. Moisturize your feet every night before bed. Coconut oil or a good lotion, applied to the sole and heel thoroughly. Never apply moisturizer between your toes. Trapped moisture breeds fungal infection. And drink 8 glasses of water daily. Your skin needs hydration from the inside as much as the outside. We're halfway through the list. Have you noticed any of these signs in yourself or someone you love? Go to the comments right now and type the word YES. Capital letters. Just that. I read every comment. Everyone. Let's keep going. Sign number 6 is more serious than most people realize, because it's not just about your feet. It's about what's happening to your kidneys at the same time. Feet and ankles that are consistently swollen. Deep sock marks every evening. Occasional swelling from activity is normal. I want to be clear about that. But persistent swelling that is always there is a different picture. High blood sugar affects the kidneys. And the kidneys control your body's fluid balance. When kidney function is impaired by years of elevated glucose, fluid accumulates in the lowest part of your body, your feet and ankles. This swelling is called edema, and it is a sign that your body's filtration system is under stress. Think of your kidneys as the filtration plant for your body. When high blood sugar damages those filters, the system backs up. Excess fluid has nowhere to go except downward. Gravity does the rest. Press your finger into the swollen area. If the indentation stays for a few seconds, that's called pitting edema. Do not ignore it. The National Kidney Foundation reports that diabetic kidney disease affects approximately 1 in 3 adults with diabetes, and lower extremity edema is frequently the first visible sign. When you rest, elevate your feet above your heart, even a few inches on a pillow, and reduce sodium in your diet. Salt causes your body to retain water, making edema significantly worse. Sign number 7 is the one I see most often misdiagnosed. By the time patients find out what it actually is, they've been masking it for years. I've been taking ibuprofen for the foot pain for months. I figured it was arthritis, maybe an old injury. Sometimes that's exactly right, but sometimes the pain has a completely different origin, one that ibuprofen will never touch. When nerves are damaged by chronic high blood sugar, they don't always go quiet. Sometimes they become hyperactive. Instead of going numb, they start firing random, intense signals that your brain interprets as severe pain. Patients describe it as stabbing, an electric shock, or a hot needle through the foot. Most often at night, think of a car alarm damaged in a fender bender. Every few minutes it starts screaming, for no reason. Nobody is breaking in. The alarm is just broken. That's what a damaged nerve does. It sends alarm signals when nothing is actually happening. The pain is completely real, but its source is nerve dysfunction, not injury. Ibuprofen doesn't fix a damaged nerve. It masks a signal your body is desperately trying to send you. A landmark study in the New England Journal of Medicine found that painful diabetic neuropathy affects approximately 25% of people with diabetes and is frequently mistaken for arthritis or age-related joint pain. Every morning, 5 minutes of gentle foot and ankle stretching before you get out of bed. And every night before bed, a gentle 3-minute massage along the sole and up the ankle. Your nerves will thank you. Sign number 8 tells me how far things have progressed. When I see this, I know the damage is no longer early stage. Doctor, I've always had cold feet. My wife has had the electric blanket all to herself for 30 years. And I laugh with them. But then I ask, are your feet cold in July? Cold under 3 blankets? Cold even when the rest of your body feels warm? Because that is when I become concerned. Feet that remain cold regardless of the temperature around you are a strong indicator of significantly compromised blood circulation. Your blood vessels have narrowed or stiffened to the point where warm blood simply is not reaching the tips of your feet in sufficient volume. Think of your blood vessels like a heating system running pipes to every room in a house. When those pipes narrow from blood sugar damage, the heat doesn't make it to the far end. The room stays cold, no matter how hard the furnace works. That cold is not about the weather, it's about the pipes. The American Heart Association identifies peripheral artery disease caused by narrowed blood vessels as affecting over 8 million Americans, with diabetes being the single largest risk factor. The best response? A 30-minute brisk walk every single day. Not a stroll, a purposeful, arm-swinging walk. This forces circulation into the feet and lower legs, strengthens blood vessel walls, and over time can reverse some of the early narrowing. Start with 10 minutes if 30 feels like too much. The important thing is to start today. Sign number 9. This is the one almost nobody ever talks about. I have never seen it covered in a patient brochure, and most people walk right past it, including sometimes other doctors. During a foot exam, I sometimes notice a visible absence of hair on the lower legs and the tops of the feet. The patient looks down and says, I never noticed that. And that is exactly the problem. Hair follicles need a steady supply of blood and oxygen to function. When circulation is significantly impaired by long-standing elevated blood sugar, the follicles in your feet and lower legs slowly stop receiving what they need. Over time, they stop producing hair entirely. Think of hair follicles like small plants in a garden. When the irrigation pipe narrows, the plants don't die immediately. They just gradually stop growing. That absence is your body sending a message about your blood vessel health, a message you can see every time you look at your legs. Research published in Diabetes, Obesity, and Metabolism found that hair loss on the lower extremities correlates significantly with peripheral vascular disease in diabetic patients, a reliable and frequently overlooked sign that physicians are specifically trained to check for. Right after this video, look at your lower legs and the tops of your feet. If the hair is significantly thinner than the rest of your leg, or absent entirely, schedule a blood glucose test this week, not this month, this week. Approximately $12 at any certified lab covered by Medicare for most of you. $12 can change the entire trajectory of your health. We've covered 9 signs, 9 chances to catch something before it catches you. Here's what I want you to do with this information. Just one thing. Tonight, before you go to bed, sit down and look at your feet. Take 30 seconds. Look at the skin. Look between your toes. Feel for numbness. Check for any wound that shouldn't be there. 30 seconds. That's all I'm asking. And if you see or feel anything on this list, call your doctor tomorrow, not next week, tomorrow. Because the earlier you catch this, the more completely it can be managed. In most cases, through a change in diet, a daily walk, and a conversation with your doctor. You worked hard for the life you have, for your independence, for your ability to do what you love. Don't let something as manageable as blood sugar take any of that from you, just because nobody told you what to look for. Now you know. If this video helped you, share it right now. With a spouse, a sibling, a neighbor, a friend, tag them on Facebook. You might be giving them something they didn't know they needed. And if you want more conversations like this one, I post new videos every week on topics that matter for your health after 60. Things most people never hear outside a doctor's office. Subscribe and bring someone you love along with you. I'm Dr. Marcus Dexter. Stay aware, stay proactive, and take care of those feet. I'll see you in the next one.